Thundermist means people, helping people. It means giving people someplace to go. It means it's a safe haven. Thundermist is a safe haven.
Everything's going to be all right. In other words, people who come here are going to be well taken care of. Everything will be okay.
Very caring individuals dedicating their time and energy to a cause that they believe in.
I believe that Thundermist is absolutely a huge light in our community.
Hope. It means here's a way to assist you any way we can.
I don't know where I'd be had I not had the silent and soft-spoken support from Thundermist.
Good morning, Thundermist Health Center. How can I direct your call?
Generally speaking, I think the community health centers have blazed an important trail that points toward the best initiatives in primary care, community-oriented primary care here in Rhode Island. And Thundermist really has been at the forefront of that. Community health centers had an interesting start to healthcare, and in some respects they were kind of these mom and pop shops where medicine was happening. And there was at that time no large building, no organization. There was a lot of organizing in the community, walking through the neighborhood.
My name is Karen Bouchard, and a long time ago, I used to work for Thundermist Health Center in 1970. And in 1970, your apartment, 62 Memorial Drive, was the very first clinic. This is where the doctors and the nurses came to work, and people would come here right here in 1970, long time ago.
Wow.
So you go to Thundermist now, and it's a beautiful place, and you get wonderful health care, don't you? Yes.
South County was our first multi-site community expansion.
And it was a risky thing for them to do, to take over a financially troubled health center. But they did, and it's been just a wonderful plan.
Health Center. I'm calling because Dr. Roth wanted to follow up with you and would like you to give us a call.
So we had a strategic interest in growth, and growth by acquisition was a smart move for us. Not to mention, I live in Wakefield, and I'll be darned if I was going to see the community health center in my community where my children had gone for care. And I didn't want to see it close, not while we had the capacity to do something about it. I started crying, Ann started crying, and I said, did you ever think this day would come? I mean, could you have imagined? And we both had in our head the image of patients who would walk through the door and finally, after all these years, be received in a building that really gave them the dignity they deserve.
But when we moved over to this new building, we made it open, with the natural light, lots of bright color, lots of vibrance. People feel special. You have people meeting you at eye level constantly. You have one-on-one guidance throughout your entire visit.
The redesign of our healthcare facilities toward patient-centered, advanced medical home models is a tremendous example of this kind of trailblazing and innovation. And many of the really radical innovations that we made, it really puts us on the cutting edge of healthcare facility design.
Healthcare is vital for everybody. No one should be denied good healthcare because they can't afford to pay.
Everybody knows what a community health center is now, and everybody knows what a community health center does.
We have to really make sure that the quality of care that we're providing is second to none. reaching out into the community with a broad array of services, comprehensive, community-oriented primary care. That's what we're about.
That's my word. Thundermist to me means hope. It always has.
I think opportunity.
Thundermist means, to me, quality health care where the patient comes first.
Caring, compassion.
Community.
And nothing less than a true family for me.
I think of my husband when I think of Thundermist.
A medical nest. A nest.
Innovation.
Continuity.
Diversity. Access to affordable health care for everyone.
I'd say courage.
Responsiveness.
It's all about giving back.
I like life. It's nice to live every day.
Caring.